Do you deal with hip pain when you're walking? I'm Dr. Chantelle with MyoLab. Let's go through how to use hip hikes to target glute med. The glute med muscle's primary job when we're walking is to stabilize the pelvis and keep them level. So we can use hip hikes as a way to actually train this in a functional movement. For this exercise, you're going to want to be near a wall. That's for balance more than anything. You're going to be standing on the leg furthest away from the wall. And when you're doing this, what you should be able to realize is that your hips can shift. That is essentially the exercise that we're going to be doing. We're going to let the hip drop a little bit, kind of moving the hip out, and then push the hip in towards the wall, squeezing that glute. It's a very small motion because if it starts to get really big, you know that you're recruiting more from your low back than is just from the hip and glute med. So this is the exercise, nice and slow and controlled. You just want to see that glute moving. If you're finding it hard to tell whether or not that muscle is firing, you can always put your hand on the side of your hip. You should actually be able to feel that muscle contract. If this is too easy, grab a ball. Now, I've got a stability ball. You can use a soccer ball, a volleyball, a rolled up towel. All you're looking for something is to go between your hips and the wall, so you have something to push into against that resistance. Same thing applies. You're going to be standing on one foot. You want to make sure you're more upright than you think. We don't want to be way out here leaning into the wall. So again, standing on one foot, hand on the hip to feel the glute working. You're going to let that hip move out away from the wall and then push and drive into that resistance that the ball is providing. You should feel like this is much more difficult with the ball. Now, one of the most common errors we see is people cheating either by rolling through their hips or by just straight up bending their knee, okay? The motion only happens at the hip joint. So you can always do this in front of a mirror to make sure that that's where it's happening for you. Thanks for watching.